Welcome. In this demonstration, I will be showing a step-by-step the process of finding and entering a member, completing the level 1 assessment, and how to retrieve notice of decisions letters for completed assessments. To get started, we're going to search for the individual within the system. You can do this by clicking Start Tasks or click Search. We will use search today. At the top of the screen, you can see scheduled tasks, member search, cases. We're going to choose member search. You can search a member 2 ways, by member ID and date of birth, or by first name, last name, and date of birth. For this training, I'm going to show how to complete a first name, last name, and date of birth search. Click search. After entering the information, if your individual or member is not found, we will use this orange button by clicking Add Member. Here is where we'll enter more demographic information. Once this is completed, you will use the Submit button. Just be mindful as you observed that all of the data fields with a red asterisk or star next to them will be required data points for information that's needed. All right, we are now here at the Member Hub. We are going to choose Utilization Management, and we're going to click Add. This will be an automatic timestamp as to when the authorization request was made. We're going to choose our review type, which is the PASRR level 1. It will automatically fill in the nursing facility and long-term care. These are auto-filled and do not need to be changed. We can choose our timing, which is concurrent or prospective. Concurrent means that they've already been admitted into the facility or now becomes a resident review. Prospective means that they have not yet been admitted. This may be a fair number of individuals that you will be doing with timing. So we'll choose prospective. We'll click Add New Request. We will choose a future admission date when the individual is expected to leave your facility, and choose an admission type and an admission source. Next is coverage. This is a section that is for review of insurance, which Telligen does not do. The answers are not reviewed, and that it is just something that is required for other contracts that we serve. We advise everyone to use NA in this comment box. And this section can be ignored for that purpose. The next section is providers. The more information you're aware of for a physician or the treating facility, the better the search and the more quick the search will go. Once we choose the correct provider, we can then choose our treating facility. We choose search. And choose our treating facility. And then we can add our ordering provider. And we can copy that. Any additional providers may be added here on these lines. Under provider organization visibility, we must select the facility that you're affiliated with. This gives a visual or access to any other Qualitrac users within the system that are part of your organization. Next, we will enter the diagnosis. One has to be entered, but you can enter more than one. As we are requesting a current list of diagnoses with the medical records being submitted, entering one diagnosis here is okay. Then you can choose by filling in the code. Choose search. You can choose to submit and add another diagnosis, or just choose to submit. The procedure doesn't require anything to be done, as it automatically fills in that you chose to do a level 1. The next section is our assessment. The first question is reporting status changes or other reasons for submitting the level 1. You can choose one of these radio buttons that best fits the reason for the member having a level 1 submitted. In this case, we can choose pre-admission. As we had talked earlier, this member is a prospective and is looking to exit the hospital to enter the facility. If there are other reasons or other better choices that fit this individual that may be coming, there are additional drop downs that can be used to fulfill what type of missing information might be needed or additional details related. The next group of questions is related to BIM scores and PHQ-9 scores. These are considered optional, but they have been helpful with making educated determinations. We use these to help identify indicators of potential neurocognitive issues or depression. And you can use the add button to add additional lines for more data. If available, we ask that you provide the last 3 scores. In sections A, B, and C, we will walk through each of these to show the questions and choosing the radio buttons. So section A is focused on the mental illness. And does the individual have a known or suspected diagnosis of major mental illness? In this case, yes, as we identified the individual to have bipolar. So choosing yes drops down additional questions for us to fill in. So we can choose an onset. If it is unknown, you can choose 1/1900. You can indicate if it's suspected or known and provide an ICD-10 code. If there's any additional symptoms or signs of mental illness, we can indicate yes or no here. And if they're on any psychotic, antipsychotic, mood stabilizing, or antidepressant medications. This is where you can indicate medications that might be prescribed to the member. Please note the red asterisks are required details. In section B, we're identifying if there's any indicators of an intellectual or developmental disability or related condition. And so the first question is, does the individual have a documented or suspected diagnosis of IDD? We can say no. If there was a suspicion, by indicating yes, there pops up a free text box to describe that in detail. We've also identified if there's any neurological conditions, such as cerebral palsy or autism. In this case, no. If the member or the individual had ever been referred to or associated with an agency serving individuals with an intellectual or developmental disability, or if there's a suspicion of a brain injury or a seizure disorder or epilepsy prior to the age of 22. In section C, this is for provisional admissions. If an individual is on a short-term stay Select yes for the most appropriate item in the group and no for the others. There will be additional information that you can choose to pop up to explain further. There's no emergency stays. There's no concerns of delirium that prevents him from being admitted, and no respite stays. The next is this blue box. So this is a reminder of the documentation that is needed to help us complete this level 1. The most recent history and physical or any medical documentation with a review of systems within the last 6 months. It can include vitals if relevant to the individual's condition, a list of current medications, a comprehensive list of diagnoses, and if applicable, upload documentation related to any active court orders for involuntary mental health treatment or psychiatric medications. You will sign your name here. If this person would need to have a level 2 completed, we ask for the name, email address, and the phone number of a person to contact to help schedule for that assessment. Finally, there's documentation. Documentation is the location where you will upload the documents that were described in the blue box. Click here to add. Provide a category. And choose a topic. And choose upload. After the documents have been uploaded, any additional notes or comments that you would like to include with this case can be added here by clicking on the add button. Once this is completed, we can use continue. Now you will complete the user attestation. Sign and submit. So in this case, if you make an error with your signing, it will give you this red flag and identify what needs to be changed or altered. And it is acknowledging the use of your username. So it will be important to know that when you fill this out. I just wanted to demonstrate this to you so that you could see that if it comes up an error. Once that is completed, you can choose submit, and you have completed your level 1 for this individual. Now I am going to show you how to find the notice of decision once a case has been reviewed and completed. We will again come back to the dashboard where we can use the search. At this time, individual case IDs have been assigned to individuals' cases. This is a space where you can choose that. You may also go and look at scheduled tasks or go to the task queue. Scheduled tasks would also have details of cases that have been completed or they're in the process. For this training, I will show you a case search. Clicking search, you will find the case ID. You can choose to click on that. In this case, once the level 1 has been reviewed, you will see at the bottom below the outcomes in correspondence is where you can find that level 1 outcome letter. And if there was any additional information that was missing, those letters requesting further information can also be found in correspondence and appear as this. Your level 2 outcomes, if a level 2 was needed, will also be found here in correspondence. Choosing the level 1 outcome, you can download that for printing. Or you can actually choose to click on it itself, which then shows you the letter. And you can choose to print from this location as well. Once that is completed, you can return back to the task queue by choosing here or here. Or back to the dashboard. You may also choose to go to the member hub. This will prompt you to ask if you would like to leave this page. By choosing leave, it directs you to the member hub. This is where you will see all of the all the cases that have been previously entered and the assessments. You can choose to click on the ellipses or the 3 dots here to view cases as well. Once completed, you can return back to the task queue. This concludes your demonstration. Thank you.